If your baby finds his or her way into the neonatal intensive care unit, you may need a pediatric ophthalmologist or a retina specialist to treat the condition of retinopathy of prematurity that occurs due to angiogenesis or abnormal blood vessel development, reaching a point of threshold which places the infant at risk of scarring, bleeding, or even retinal detachment. Threshold is defined by blood vessel development and tortuosity and can be demonstrated by paper charting or the new ROP-Check software from Glacier Medical Software. The ophthalmologist's challenge is to deliver adjacent retinal laser spots through a dilated pupil to the retinal periphery to turn off the chemical messengers coming from stimulated avascular retina. Here are confluent laser burns in the peripheral retina attempting to turn off the plus disease of threshold retinopathy of prematurity. The baby can be treated either in the NICU or the operating room. The surgeon directs a laser light through a lens through the dilated pupil. The energy and the number of spot sizes are recorded on this iris diode laser. If a laser is not available, cryotherapy still can be delivered across the wall of the sclera to turn off the avascular retina and chemical messengers. Remember, stages of retina going from stage 1 to stage 2 and worse to stage 3, the peripheral retina is then treated with a laser to turn off the chemical messenger. These are actual movies taken by Dr. Anna Ells using a RetCam digital camera. This is a left eye developing stage 3 and having cryo scars in the periphery. A good result. This is another left eye developing plus disease and a stage 3 ridge in the temporal periphery, and here are the laser treatments and scarring resulting in a good result. This is a hazy left eye with the development of vessels. They become tortuous with plus disease and reaching threshold, and here's the result of the laser treatment that did not get all of the temporal periphery, leading to some traction of the retina, and here's a small hemorrhage. This is a right eye with a worse situation, very difficult to see, very premature baby, reaching threshold, and eventually getting laser scars, but still having a scarring effect and a dragging of the retinal to the temporal periphery. This is how a paper chart would show reaching threshold and improving afterwards. This can also be shown on ROP-Check software and printed out for the chart or for the parent's education. After surgery, the patient may eventually need glasses, strabismus surgery. Even with thorough treatment, some patients still go blind. Remember that ROP can advance through stage 1 to stage 2 and stage 3 and threshold for peripheral ablative treatment to turn off the chemical messengers. If your baby does need treatment in the NICU or the operating room, we trust that the treatment will do its very best to preserve sight in your infant. Thank you.